We are here today at the Siena Emergency Department to talk to you about COVID-19 preparedness and safety. So the emergency department is prepared 24/7 to take care of medical emergencies. So at this point in time, we're still just as prepared as we were 2 months ago when COVID first came to Nevada. We are very concerned that the community is not coming in or delaying their visits to the emergency department for emergency medical care because of the fear of acquiring COVID-19 when they come to the hospital.
Where's your belly hurt?
Just below like my ribs. Yeah.
We've had patients that have put off abdominal pain coming in, and then when they did come in, it was diagnosed that that patient either had a ruptured appendix, had to have emergent surgery. We've had patients who have put off chest pain that have come in hours later, if not days later, to find out that they have had a heart attack, as well as stroke patients who've had neurological changes at home, and because they're fearful to come into the emergency room, they did not come in and then had suffered stroke symptoms.
Hi, you checking in as a patient?
I am.
You need a wheelchair?
Please.
When a patient arrives in the emergency department, we've always had a health professional screen them for signs and symptoms of COVID. At that point, if we are concerned with it at all, that patient is immediately isolated to a separate area in the emergency department. We have also been able to provide a mask to every patient who walks in the door and every family member that is able or necessary to accompany the patient.
Our staff is all completely masked as well. Patients that present to emergency rooms today will be allowed to have one visitor while they are a patient in the emergency room. I am a mother of two, and I do understand the fears of parents concerned with bringing their children into emergency departments. But our children and their parent are also being masked and protected, as well as that staff. We are the only emergency room in Henderson that does have 24-hour pediatric services in the emergency room. We have pediatric physicians and special trained pediatric nurses that are there to provide the care for all of our pediatric patient population.
Hi, Sydney. Hi. Heard you hurt your ankle.
I did.
Okay, what happened? What'd you do?
Well, I tripped over my dog.
If you think you have an emergency medical condition, if you have chest pain, if you have weakness, if you have shortness of breath, if you have the worst headache of your life and you think you need to be seen, we're here for you. And we're completely able to take care of your emergency care needs 24 hours a day, 7 days a week, 365 days a year.
When people need us, we're always here.